Well, namaste to all. Welcome to Easy Ayurveda Gurukula episode 21. Today we have with us Dr. Sidram Gulet sir. Before introducing our guest speaker, a cordial welcome to all our participants to this particular session of Gurukula. So may I kindly introduce Dr. Sidram Gulet sir. Before that, on behalf of Easy Ayurveda, Family Easy Ayurveda and all the participants, I extend my cordial welcome to Dr. Sidram Gulet sir. Namaste and welcome to Gurukula session, sir. So a brief introduction before I pass on the dash to Dr. Sidram Gulet sir for today's presentation. Dr. Sidram Gulet sir is currently working as assistant professor in UG and PG departments of chikitsa at Government Ayurveda College, Ayurveda Medical College, Mysore. So very good academician, sir is, and a very good practitioner as well. Has presented many scientific papers in many national and international seminars, given guest lectures, awareness speeches, and conducted many camps, and oriented and dedicated himself towards the health services and also academic activities. So the field of interest, as Sidram sir himself writes, is understanding and implementing samhitas in clinical practice. That is very, very important. We read samhitas, but bringing the basics and also the principles in the samhita to the practice is very important, and Sidram Gulet sir is doing that in the right direction. So today's topic, Sidram Gulet sir will be presenting, will be Trika Shula and its management with spinal disorders. Without wasting any time, let me hand over the dash to Sidram Gulet sir. Sidram Gulet sir, it's all yours. You can start the session.
Thank you, sir, for your warm welcome and introduction. Ragadi rogan satatanu shaktan asheshakaya prasutan asheshan autsukya moha ratidan jagana yo purva vaidyaya namostu tasmai. My heartfelt pranamas to all great Vaidyas of Ayurveda and all Vaidyas of today's era. And I also wish the budding Vaidyas who are going to become the Apurva Vaidyas of Ayurveda fraternity. The Vagbata has used the word, he saluted or his salutations to those Apurva Vaidyas na Purvo Bhavati. So he is expecting an ideal practitioner, and he is welcoming and wishing the Apurva Vaidyas. Respected Dr. Raghuram Vyas sir and Dr. J.V. Hebbar sir and all the team of Easy Ayurveda and all the respected teachers, practitioners and students and scholars who are present over here. Let us begin with my topic of today discussion, Trika Shula and its management with special reference to spinal disorders. So back pain or the cervical pain or the spine pain is the commonest, the most commonest presentation in today's practice that we encounter. Everybody, everyone, at least once in their lifetime, they will suffer with such kind of problems. So today's medicine or the conventional practice of medicine is not able to provide the benefit as expected. Only the analgesics and surgery are the options, and there are very poor success rates of surgery in the spine as concerned. Bone and joint conditions are well explained in Ayurveda, and also there are variety of treatment options are available. So there is a need of understanding the utility of Ayurveda protocols in different conditions of the spine so that we can succeed in our practice. So I deliberately use the word Trika here. So not to confuse you, because Kati Shula and Griva Shula are the very commonly used terminologies. So I have used the word Trika just to highlight the importance of the area Trika in clinical and its clinical significance. So only to show that, only to tell that I have used the word Trika, and many a times the Trika word is being given by the Acharyas in the classics. Then what exactly the Trika is? Trika is just like a tree, a union of three. Triyanam Sangaha, the union of three subjects or three particles or three substances. So here, in the context of bone and joint, so the Trika is Prushta Vamshadaraha. It is an support of Prushta Vamsha. So where exactly it comes? So it may be Prushta Vamsha is the support of the total vertebral column. So there it comes under lumbosacral area, which supports the body as well as the whole spine. Moving further, the apte, he has defined the word trika as the part between the shoulder blades and the lower part of the spine, the part about the hips. So in that dictionary, he has defined the two areas of trika. One is the upper, it is called as urdhva trika. The word is used in Ayurveda as urdhva trika, the cervical region, and other trika, that is lumbosacral area. These two areas are very crucial as a the number of diseases or disorders happening at this particular area. So this is an highlight of the word trika. So I was mentioned, I have cleared that the word trika is nothing but the kati in the adabhaga and cervical region in the urdu bhaga. And the vata is the main seat of vata is the main dosha which is taking accumulated in the kati. So the seat of vata is kati. So in kati, vata is the main dosha that is sthana is there. Pakvashaya kati sakti, srotrasti sattvanendriyam, sthanam vatasya tatrapi pakvadanam. Especially the specific site of kati. And in vata, specifically, apana vata is the main dosha that is there in the Shroni. The word Shroni is the Bhaga Pradesha, the totally the bony surface area or even the inside of the Shroni. The apana vata is the main dosha that is situated in the Kati. So then what is the relation between the Trika and Kapha and Ama dosha? Kapha or Ama dosha? You might be very familiar with this shloka, which is being taken from Amavata. Amavata is not a single disease. The Acharya has mentioned Vyadinam Ashrayo. So Vyadinam Ashraya, it is a seat or the Ashraya for many of the diseases, that is Amarasa, which can cause a variety of diseases. In that context, in the Samprapti of Amavata, he has used the word that Yugapat Kupitav Antaha Trikasandhi Praveshakahu. So we know the Amavata is an Sandhigata vikara. So Trika is also a Sandhi. And later he has mentioned Sandhi Praveshako, Trika Sandhi Praveshako, Trika Praveshako and Sandhi Praveshako. So separately an importance is given to Trika Bhaga here. So which is an prime location of accumulation of Ama. Whenever there is a Amarasa in the body, it mainly or immediately accumulates in the Trika Bhaga. That is what he seems to say here. So Yugapat Kupitav Antaha Trikasandhi Praveshako, and it will also accumulate in the sandhis of Sharir. And then later Stabdam Kurute Gatram Amavataha Saucha. Later he has used the given the explanations in the commentary. Vata Kapha Yugapat, here he mentions along with the Ama, the Vata Kapha dosha has predominant doshas in combination, they will accumulate in the Trika Sandhi. So then what is this Trika? He has mentioned Trike Katimanyashaya Sandhi. So he has used two sides of Trika. One is Kati, another one is Manyashaya Sandhi. The Sandhi in the Manya, the Sandhi in the Kati are the Trika, Urdhva Trika and the other Trika. Cervical and lumbosacral areas are the prime locations for immediate accumulation of Samavata or Kapha. Whenever you think of Ama, you should always or whenever you are having a problems with the cervical region as well as the lumbar regions, you should always remember the Samavata or the Kaphavata. And this Trika Shula or Kati Shula and even Griva Shula or Manya Shula are the separate entities that are considered in Nanatmaja Vata Vikara. They are independently have the ability to occur. They have been identified and they have been researched. So the burden of those conditions are being depicted here. And Trika are also considered as the marma. Those are asti marmani ardhangle vaikalyakarini. So these are vaikalyakaraka as well as asti marmas. So we have to be careful in dealing. Coming to the Pruštavamsha or Astiva Srotas. The Pruštavamsha is a Astiva Sroto Bhaga. So in Nidana, in causes of the Astiva Sroto Dushti, the Acharya has very meticulously mentioned the Nidanas of Astiva Srota. Vyayamad Atisankshobhat Asnam Ativigattana Astivahini Dushyanti Vatalanamcha Sevana. Here, a second place is given to Vatalahar. Before that, he has considered the Viharas. So the external factors or the habits of the body positions has been given an importance here. Those will are the prime causes for the manifestation of those related diseases. So even in the Vatavyadi Nidana, Charaka has mentioned Lavanatyadva Vyayamati Vicheshtitaihi, and also he has further noticed or mentioned Dukkha Shayyasana. So the postures, the exercise, the viharas of the person matters more in the diseases of skeletal system. So exercise, gym, weightlifting, sankshoba, that is an injury, shocks and vibrations, especially nowadays observed with the vehicle ride. Ati vigattanam. In modern medicine, also conventional medicine have identified risk factors for the development of spine diseases are wear and tear and the weight bearing, overstretching of the joints, overuse of the joints, and then dukkha shayya and asana. This is also most important. So nowadays, the people are using chair bound and using the systems all the time. So the improper sitting, standing, and sleeping postures are also an important contributing factors for the development of the skeletal disorders, especially the spine diseases. And then coming to the Sandhigata vata. So we are discussing about the Prishtvamsha or the spinal. So it is also a disease or a pain in the Kati Bhaga or the in the Griva Bhaga is nothing but the very basic Sandhigata vata condition. So the Acharya has mentioned Shota and the Shula are the two main presentations of Sandhigata vata. And then coming to the specific Kati Shula or the Kati graha. So this shloka has been taken from the Gadani graha, Vatarogadikara. It has mentioned Vayu Katyashritaha Shuddhaha Samo Va Janeyedrujam. So in Kati, there are two types of conditions of Vata, either Vata with Ama or alone. So Shuddha Vata as well as Vata associated with Ama. If Vata association alone is there, you will have the people will be having the only Shula and other Vata conditions, Vata Rujas. And if Ama is associated, Kati Graha, the stiffness will be accompanying. Then coming to the Gridrasi, it is an extended condition of the Katishula or Katigata Vata. And the Katigata Vata is severe, it is going to lead into the Gridrasi. In mentioning the Gridrasi, the definition of Gridrasi, the Ashtanga Sangraha and Ashtanga Hridaya, Vagbata has considered Parshni Pratyangulinam Yakandara Sa Marutarpita Satukesham Nigrannati Gridrasim Tam Prachakshate. So very interesting definition has been given by him. Tam Kandaram Vyadi Vishesha Samjnam Gridrasim Prachakshate. There are different definitions of Gridrasi, like Gridravat walking style is like Gridra and all those things are given. So we accept those also. But here he has mentioned Tam Kandaram, Ya Kandaram, Tam Kandaram, Gridrasim. That Kandara which is affected here, it is called as Gridrasi. What he is mentioned, Gridrasi or the Kandara is considered as Gridrasi here. Tam Kandaram, Vyadi Vishesha Samjnam, Gridrasim Prachakshate. So whether he is referring to an sciatica nerve, which is the largest nerve in the body, longest as well as largest nerve in the body. So whether he is referring to that Tam Kandaram Vyadi Vishesha Samjnam Gridrasim Prachakshate. There are definitions for Kandara as the ligaments that is there, but still is he referring to the Gridrasi Nadi as well? So we have to think over it. So the application of Kandara from the fingers of foot and heel to Janga, Urus, pick and back, limiting the functions of the limb due to the pain is called as the Gridrasi. Further, it is being mentioned that there are two varieties of Gridrasi. One is Shuddha Vataja, another one is Vata Kapha. In Shuddha Vataja, there will be Stambha in the form of restriction of movement, inability to move, and then Ruk, Toda, Grahana, and Spandana, a type of shulas that are observed. Aching pain, shooting pain, and the restriction of the movement. First afflicting in the stick, later spreading to Katiprishta, Uru, Janu, Janga, and up to Pada in a row. And in Vata Kaphaja, so there will be association of Kaphaja Lakshanas, for example, Tandra, Gaurava, Arochaka, Stamba, Gaurava, and then difficulty in bending and moving the Katibhaga and all those things can be considered. So this is of Vata Kaphaja. So Gridrasi is an lumbar radiculopathy like of presentation. So as Gridrasi is there in the Kati Bhaga, the disease of Kati leading to the Gridrasi. There are also Viswachi that is caused by the disease that are happening in the ग्रीवा भाग तलं प्रत्यंगुलनाम या कंडरा बाहु पृष्ठतः बाहु चेष्टा प्रहरणी विश्वभि नाम सा स्फुटः या कंडरा सा विश्वभि. The same kandara is called as Viswachi if it is causing the pain from the back of the neck to the bahu and even the anguli of the hands. The pain and is observed, that is called as the Viswachi. And further, the acharyas have mentioned, is there any relation between the, so the word Khalli is being explained. The acharyas have mentioned Vishwabhi Gridrasi cha ukta Khalli Tivra Rujanvita. If Viswachi and Gridrasi occurs with Tivra Ruja, very severe pain, they are considered as Khalli. But the Charaka has used the word Padajangoru Karamulava Motani. So for Avamotani, he has used a subluxation or a kind of detachment or a severe injury. Padamula and Karamula he has used the word Pada and Karamula. So is he referring to the Mula of both Pada and Kara, that is the upper limb and lower limb, which is happens to be the cervical region. So the avamotana is a severe injury. Avamotana is a detachment, just like a severe injury that can cause the symptoms or the pain, severe pain and disabilities in the both upper limbs as well as lower limbs. So which can be called as the Khalli, or else which can happen alone in the Kati Bhaga or in Griva Bhaga, that is causing the severe pain of the like Viswachi as well as Gridrasi. It is a very severe condition of Gridrasi and Viswachi. So these Prushtavamsha diseases or the spinal disease also present with daha and Harsha and even Suptata also. They are the conditions which are associated with Pitta in Padadaha, Pitta and Rakta in Padadaha, and Kapha in Padaharsha, and we have to consider in the treatment aspect also. So these are the some of the terminologies, some of the diseases, conditions that are explained in Ayurveda that can depict the diseases of spinal cord or the Prushtavamsha. So now coming to the conventional understanding of those spine diseases and how can they relate in Ayurveda and how can we formulate and treatment considering both the sciences. So this is, we know all that there are four regions of the spine: cervical, thoracic, lumbar and sacrum. There are different parts of the spine and back. The injury or the condition of different parts of the spinal cord can lead into the pain and other symptoms. So those are vertebrae, spinal cord, intervertebral discs, ligaments, tendons and muscles. Injury to any of one or combination can lead into the pain, and we have to consider in the treatment which part of the spinal cord is being. There are risk factors for the development of spinal diseases, which are the exercise related fitness level. So who are not physically fit or active, and those who exercise too strenuously after being inactive for many days or many time. Factors are like heavy lifting, pushing, pulling, or twisting. It will injure the back or the vertebral column. The desk job and poor postures are the important risk factors, and even stress level, anxiety. The age is an which can happen with the age, especially after the hereditary conditions like HLA B27, like other conditions, have an important role to play in the manifestation of back disease. So what are the common symptoms of the spine? Are the increasing pain with lifting and bending. The pain worsens when resting, sitting or standing, and the stiffness will be more in the morning hours and lessened after some activity. The pain in neck radiates to upper limb with numbness and weakness. The pain radiates away from the back into the buttocks, leg and hip. The numbness or weakness in the leg or feet, and in severe cases, bladder and bowel disturbances are also being observed. So what are the causes of these diseases? The pathological causes. In the mechanical causes are the more important causes, which are happens to be more commonly, are the sprain, the disc diseases, degenerative disc disease, herniated or the ruptured discs, spondylolisthesis, spinal stenosis, fractured vertebrae, scoliosis, and other congenital changes to the spine. These are the very commonest conditions of the spine that are leading into the disease of the spine. There are other causes of the spine, inflammatory conditions, any infectious diseases that are happening, being affected to the spinal or the vertebral column that lead into the inflammatory arthritis of the spine. And the most common is being ankylosing spondylitis, which is believed to be played by an gene called as HLA-B27. There are other medical causes, medical conditions which can lead into the spine problems are osteoporosis, fibromyalgia, the visceral causes like kidney stones, infections, endometriosis, tumors, cysts, pregnancy. So these are also the other causes which are I'm not going to discuss about those issues here. So we will discuss in detail about the mechanical causes of the spinal diseases are the spondylosis, spondylolisthesis, degenerative disease, canal stenosis, sciatica, myelopathy, Kodakuna syndrome. So the first 5-6 I will discuss in detail, which are because they are very common to occur. The spondylosis, both cervical and lumbar. So spondylosis is not an single condition; it is an umbrella term for different forms of the age-related degeneration of the spine. It is caused by the degenerative condition of the spine. The people age, their bones, discs, cartilage, and ligaments change with age. The bones will spur, the disc will dry and crack, the cartilage will wear out, and the ligaments will be thickened. So these age-related degenerative changes are the forms of spondylosis. There will be a loss of disc height, reduced disc space, marginal sclerosis. So that can be identified in the MRI as well as in the X-rays. So another condition of the spine, that is spondylolisthesis. So listhesis is a Greek word coming from the oleothesis, meaning the slipping. So one vertebral body slips over the other. So that is called as a spondylolisthesis. Spondylolisthesis describes the abnormal slipping or dislocation between the two vertebrae. Sometimes they will be not having any symptoms. When a chronic condition of listhesis is there, they may have the low back pain, leg pain, or neurogenic claudication, which is observed in the spinal stenosis. There are 5 varieties: isthmic, degenerative, traumatic, dysplastic, and tetanosis. So there will be a dull aching pain in back, buttock, and the posterior part of the thigh. So usually it happens in the L5-S1 region. The radicular symptoms are also rare, but it can be observed. So sciatica. So sciatica is a pain that starts in the lower back and radiates through the buttock and down to the back of the leg. We all know it. And it is caused by the compression of the sciatica nerve in the lumbar spine or lower spine. The sciatica nerve is the largest single nerve in the body. It begins in the lumbar spine and runs through the buttock, down the back of the leg, and into the foot. So it is compressed at its exit from the spinal cord. The symptoms can radiate along the entire length of the nerve. And it is called as it is a type of radiculopathy. The symptoms are, it may be caused by a herniated disc, or it may be caused by a canal stenosis, which are the 2 main causes. There will be constant pain in one side of the buttock, or even both legs can occur. So burning and tingling sensation in the pain may occur, usually worse when sitting. So weakness, numbness, or difficulty in moving the leg is observed. Foot drop, a sharp pain that may take it difficult to stand up. So sometimes the patients will come with a very severe pain that even they are unable to sit on the bed. The other disease is degenerative disc disease. The degenerative condition of the disc may not be a problematic. When it takes a form of disc disease, so it will be a problem. So above the age of 16, 90% of the people will show evidence of some disc degeneration. So the disc will dry out, thin, and crack. And what happens? The soft cartilage core will bulge out, and they may herniate out through the fibrous outer portion of the disc. When a fibrous outer portion is teared, so the middle or the nucleus jelly-like substance will herniate through the fibrous outer core. The degenerative disc disease is an umbrella term, as I have discussed. So due to the age-related processes, sometimes it is normal and does not necessarily cause the pain. So there are different conditions of the disc degenerative disease. They are disc desiccation. The disc desiccation is just the dehydration of the disc, degeneration of the disc. So when it becomes severe, it will bulge, that is called as disc bulge, where outer wall of the disc weakens and the inner portion bulges out. If it becomes severe, then it leads into the herniation of the disc, where the outer portion is torn, so that the middle portion of the disc herniates and cause the severe pressure over the spinal cord. So this is the very severe form of the disc problems, spinal canal stenosis. Stenosis is nothing but the narrowing of the spinal cord. The bony structure that encloses the spinal cord is called as the canal, spinal canal. and the nerves. The spinal stenosis usually develops gradually due to age-related spinal degeneration. It is also a condition of degeneration. So the most common in the people around the age of 50 years, and it is considered as the significant cause of the disability. So the most cases of spinal stenosis occur in the lumbar spine, and even it also occur in the cervical spine too. So rarely spinal stenosis occurs in the thoracic spine. So the cervical and lumbar are the main spaces where stenosis can occur. What are the causes? The spondylosis itself is the major cause of the spinal canal stenosis, and other than that, thickening of the ligaments, degeneration, herniation, and bulging of the intervertebral discs, formation of synovial cysts are some of the other causes. So in the cervical canal stenosis, specific symptoms will be observed. So mainly the numbness and clumsiness of the hands, balance and coordination problems, and the stiffness of the leg, or and then the weakness and incoordination of the arms and hands, difficulty with fine motor control of the hands, such as buttoning, tying, writing, and so the fine and coarse motor functions are involved here. Even the bladder and bowel disturbances are also being observed. In lumbar canal stenosis, low back pain, the same symptomological conditions are observed. Very specifically, neurological coordination is there. So whenever a person stands up or walks for some distance, a very heaviness in the leg as well as a severe pain will be observed, which makes him disabled. So that he has to sit down, take rest, then only he will be able to. It's a very severe condition. It should be very carefully managed. So this spondylitis is an inflammatory condition, so which is very rarely occur, but it can cause a significant source of pain and disability. The most common is ankylosing spondylitis. So it involves the inflammation in the areas where soft tissues are, like ligaments and tendons, are the main areas that it can affect. So the treatment line of treatment will certainly change in inflammatory such conditions. The tissues will erode, the new bone growth will happen. When inflammation subsides, the new bone growth will be there. As there is a new bone growth, so there will be a union of the bones will happen, or the discs or the vertebrae will happen, that will lead into the bamboo spine, what we call a bamboo spine. Other infectious conditions like arachnoiditis, discitis, sacroiliitis, which are caused by different infections, then we'll also have the such presentations. This is the picture depicting the ankylosing spondylitis. So we also encounter the cases of ankylosing spondylitis. As I mentioned, the Trika bhaga is mainly involved, where Ama is specifically involved. So Ama vata line of management is very specifically helpful in the such conditions. So now coming to the understanding of the chikitsa of these diseases we have discussed till now. So as Katigata vata or Grivagata vata is basically a Sandhigata vata. So what are the Sandhigata vata chikitsas we will discuss now or see. Snehopanaha agnikarma bandhanonmardhanani cha snayu sandhasti samprapte kuryad vayo atandritaha. A specific word is used, vayo atandritaha kurya. Chikitsa, Charaka has mentioned, Charaka Ivan Sushita has stressed upon the word atandritaha, without any rest. The Vaidya has to give the treatment continuously for long period. To treat the Vata Vyadi, continuous efforts are necessary. So the training of a Ayurveda Vaidya to treat the Vata Vyadis is like, so it has to be done continuously for longer duration. You cannot expect the results within a few days or few time. So Snehana, Upanaha, Bandhana, Agnikarma, and Unmardana are the very basic chikitsas that are mentioned. He has mentioned the word like Upanaha. So in the Vyadipratyanika chikitsa, which are Vyadipratyanika chikitsa, Upanaha is also another treatment. Even Agnikarma is also mentioned, Bandhana is also mentioned, other Snehana Upakramas. So Upanaha alone can prove as the sufficient treatment of some of the diseases of Vata Vyadi, or especially Sandhigata Vata Chikitsa. Coming to the treatment of Trika Shula, as I mentioned, so he has mentioned Kared Valukasvedam Trika Shule Prayatnataha Yadva Adastat Karishagnim Dhare. He stressed upon the Ruksha Sveda. We have to go for Ruksha Sveda when a Trika is involved. So we have to tackle first with a Ruksha Sveda. Valuka Sveda, Karishagni Dhara, below the Kati, Dharana, and then the Shimula Seka, Takra Seka, Dhanyamla Seka. So we have to go for this Ruksha and Sagni Sweda. And we have to do the Svedana we are doing just in the Amavata Chikitsa. So this is the first line of management we have to target in the Trika Shula. And then Viswachi, the cervical region, when a Viswachi like presentation is there, how to proceed. So as mentioned, Vamana and Nashya are the treatment of choice we have to adopt. Otherwise, the Snehana, Unmardana, those all treatments of Sandhi can be adopted in specific. In addition to those all Sandhigata Chikitsa, Vamana and Nashya has to be adopted. Coming to the Gridrasi specific treatment, as mentioned, Siraveda, Agnikarma and Bastikar. These are the main treatments he has mentioned. And there seems to be the treatment of Kevalavata. And when to perform these upakramas, when to start these upakramas is an important step in the initiation of the treatment. Chakradatta, the Chakradatta Chikitsa has highlighted the importance of Basti Karma as well as before going for the Basti Karma in or Snehana Karma in Gridrasi, what we have to give an importance. Gridrasyartam naram samyak Pachanadhyaihi vishoshitam Jnatva naram pradiptagnim Bastibhi sampat Madho Bastividam kuryat Yavad urdvam nashuddhati Sneho nirartakaha tasya Basmayet ahutiryata. So it is useless or it is not useful if you can't do the Pachanadi upakramas or Shodhanadi upakramas in the Gridrasi or in other Katigata and Trivagata diseases before going for Basti. So Basti can only be helpful when Pradipta Agni is. So he is mentioning Pachanadi Vishodhan in the Gridrasi and like conditions for the successful treatment of the issues. So he has mentioned Yavad Urdvam Na Suddhati. Urdvam Pakvashayena Urdvam Na Suddhati. Unless and until you do Pakvashaya Urdva Deha, like Pittashaya, Virechana, Amashaya, Vamana, and in the Vamana, Langana, and Pachana Upakramas. These are the things he is talking about here. Then only you have to go for the Basti Karma or Snehana Karma. So you have to target Ama and Kapha and later Vata here. How to perform Shodhana and Pachana here? You can go for classical way of Shodhana, so whenever necessary. Otherwise, this conventional method that has been mentioned by the Acharyas that will be sufficient. Snigdha Virechana yoga with Pachana Dravyas. Those Pachana Dravyas we should have Ama and Kapha Pachana, and yet they are not Vatakara and they should be Vata. As I was mentioning, Apana Vata, Apana Gaha, isn't it? We have to show the Vata its path. So then only it is we are able to treat those conditions. So there are different yogas are mentioned. So I will mention a few of them here. Dashamulo Bala Arasna Gudichi Vishwaveshijam Pived Derenda Tailena Gridrasi Kancha Pangushe. So Dashamula Gudichi Vishwaveshi. So Dashamula is the main ingredient we have to use in the treatment to perform the Pachana Upakrama. Along with that, you can add the other drugs and especially the Erenda Taila that will take care of the Vata here and Shodha. The other Panchamuli Kashaya is there with Erenda Taila and the Erenda Taila with Ardraka Matulanga Swarasa. There are many yogas are mentioned here. And then Erenda Taila with Gomutra for 1 month as well as Gomutra or the Erenda Taila with Nagarambasa. Dashimuli Kashayena Pibedva Nagarambasa. So Nagara Jala and Dashimula Kwate, or it can be used in the Kati Shula with Erenda Taila. And some of the specific yogas like Chapalika Patrakwata is mentioned in Gridrasi and Grivastamba Katutaila Abhenga and Gomutra Lepa with Ashwagandha, and in Manyastamba Dashimula Panchamula Kwata, Pana and Sekam, Rukshasveda, Nashya are mentioned. All these yogas that are discussed now, they mainly focus upon the Pachana and Anulomana and Shodhana of the Kapha and Vata and Ama. There are some yogas are there that can be used. Amrutadi Gugulu, whenever there is a Pitta and Rakta is associated with Vata. You can use Simmanada Gugulu and Kaishora Gugulu when Ama like conditions are there. Triyodashanga Gugulu when Vata Kapha is very predominant, Graha, which is very favorite of my choice. Rasna Gugulu is mentioned, Kati Shula and Griva Shula. Vishatundukavati, so I use widely this drug because Sarva Vetan Vapohati, so it is used for Kupilo. So neuralgia, neuralgic pains or radiculopathies will be well managed with the Vishatundukavati. Vaishwanara Churna whenever the Ama association is there. And also, rarely I will use the Kashaya, Mustari Marma Kashaya that will take care of the marma. Gata, Agha. And another important yoga that I suggest and I use to my patients is the Rasana Saptaka Kashaya, which is mentioned in the Kati Shula chikitsa itself or in Gridrasi chikitsa. So it contains 7 drugs. With Kashaya, you have to add Shanti Prakshepa that will take care of the Ama and Kapha. And the Rasana Guggulu, which contains Rasana Guggulu and Grita, which is mentioned in the Kati, Shula and Gridrasi. And another my drug of choice is the Triyodashang Guggulu, which contains 13 varieties of drugs, which is specifically indicated in Vata Kapha Vikaras, Kati Graha, Gridrasi and Griva Shula. So going for all these drugs, when we are done with the Ama Chikitsa, Pachana Chikitsa and Vatanulomana, so Kevala Vata Chikitsa has to be adopted, and it is not like that once upon a time in a one sitting we will treat all the kapha dosha and ama dosha. There will be association of ama dosha with vata, so we have to plan basti in a such a way that it should be helpful to vata first and also to the ama and other associated conditions. So in different conditions of spine we will use different varieties of bastis. Irandamuladi kashara basti, kshira vaitarana basti, panchatikta kshira basti, mustadi rajayapana basti, Madhutailika Basti and Matra Basti we will use in our clinical practice. So coming to the Irandamuladi Kshara Basti, so most of the Vaidyas will use this yoga Basti, which is very effective in conditions. So we extensively use in Amavata and like conditions and even in Gridrasi and Kadishul. So conventionally we use this yoga, which we indicate in the Katishula, Grivashula, Gridrasi that is associated with Vata and Kapha. Kevala Vata conditions, we don't use Erandamala Dikshara Basti. Whenever it is associated with Ama Kapha and stiffness, we will use this Kshara Basti. Another one is Kshira Vaitarana Basti. So where Vaitarana Basti is fortified with the Kshira. Instead of Gomutra, the Kshira is used here, so it is named as the Kshira Vaitarana Basti. So here they are the preparations, Erandamuladi Kshira, so 200 ml we use, and Sneha, Gudapaka, Chincha Kalka and Saindava. In this preparation conventionally we use in this matra, so which we indicate in the Katishula, Grivashula, Gridrasi, which are associated with the Dhatuksha, as well as Ama and Spondylitis, stiffness and canal stenosis. In these conditions, we use the Kshira Vaitarana Basti. Another one is Panchatikta Kshira Basti. So it is mentioned in the Samhita that Astashayanam Vyadinam Panchakarmani Beshijam Bastaya Kshira Sarpimshi Tiktakopayitanacha. Tiktaka Kshira Bastis are best in Asti Sandhigata vikara, especially in Kevala Vataja or Astikshaya Janya vikara. So degenerative conditions, spondylosis, degenerative diseases, Dhatukshaya, these conditions we use the Panchatikta Kshira Basti, which is the yoga we use conventionally in our clinical practice. So another widely used the Yapana Basti in our practice is Mustadi Raja Yapana Basti we use. Whenever the patient is debilitated, whenever the patient is weak and is associated with Vata Vyadis, we choose Mustadi Raja Yapana Basti. Mustadi Raja Yapana Basti will be used for varied conditions. So even in Katigata Vata or Grivagata Vata, whenever there is a debilitation is there, so we will choose Mustadi Raja Yapana Basti in our clinical practice. These are the conventional method or the different proportions of different dravyas we use in Mustadi Raja Yapana Basti. Whenever there is a degeneration, Dhatukshaya is there, Shula is there, loss of strength is there, so we choose Mustadi Raja Yapana Basti. So another important or peculiar Basti we use in practice is the Madhutailika Basti. So Madhutaile Same Shatam, Vatesche Eranda Mulacha, Lardam Shatapushpaya, Tato Sendavash. So in the particular proportion, this Madhutailika Basti is mentioned, where Madhutaila is very predominant part and they are in equal quantity. So both Madhu and Taila are used in equal quantity. So Taila is for Vata and Madhu is for Kapha, like Vata Kapha conditions, and usually we use it. So this is the conventional way we practice the doses and proportions. So we recommend use of Madhutailika Basti in burning and tingling sensation of the patients with spinal diseases and even canal stenosis. We prefer the Madhutailika Basti, which is fortified with the Phalen Ekena Sanyuktam Kajena Cha Viloditaha. So Madanaphala is advised to add in the Madhutailika Basti that can help in Sukena Dosha Shodhanam. So it removes the doshas very in a way that it cannot cause any problem to the person or any complications to the patient. Without giving any complications or debilitation to the patient, it will sukena dosha pravrutti. It will do the dosha pravrutti very mildly and in a significant way. And coming to the Anuvasana Basti or Matra Basti, Sahacharari Taila, Kshirabala Taila, Brasandavaya Taila, Panchatikta Krita, Dhanvantaram Taila, and different varieties of Tailas we use as the case may be. We usually prefer Emakabastis, which are a combination of Taila and Grita both. So usually Panchatikta Grita and the one of the Taila we use, especially in Kevalavata, like acute sciatica conditions, especially when there is a acute sciatica. We should not directly switch on to the very strenuous Abhyanga and all those things. So better to go for the Anuvasana Basti or Matra Basti or acute neuralgia conditions. In such conditions, so even Abhyanga can aggravate the pain, so that we carefully we have to manage, otherwise we lose the patients. In such conditions, Kevala Matra Basti can be helpful. Coming to the Bahir Parimajana Chikitsas, it is a mentioning of Abhyanga, Sweda, and local bastis like Griva Basti, Kati Basti, and Pushta Basti we practice. Lepa like Kotum Chikadi, Nagaradi, Dashanga, and Upanaha, Lepas we prefer. In Svedana, the varieties of Svedanas are mentioned, and we have to use it very cautiously according to the condition as it presents. So in Parisheka, we use Dashmula Kwata, Takra, Dhanyamla, and we also use Valaka Sveda and Tapa Sveda and Masapinda Sveda. The above two we use in the Ama and Kapha conditions. Masapinda Sveda we use in Kevalavata. So I usually, when a patient comes to me, so for few days of earlier treatment or Panchakarma, we go for Ruksha Sveda. Then we will switch on to Snigdha Sveda, like Mashapinda Sveda. So I practice Mashapinda Sveda very extensively in place of Shashtik Salipinda Sveda or other Patrapinda Sveda. We practice Mashapinda Sveda. It has given a very good improvements in the conditions. And we can also practice Patrapinda Sveda when the pain is predominant. Jambira Pinda Sveda, Vataka for association. Upana Sveda, whenever there is a swelling, contracture, severe deformity is there. So Upana Sveda alone can give a very good improvement. And especially Lepas we use in the swelling and very inflammatory conditions of the. And at the end, the Acharyas have also highlighted the importance of Agnikarma and Sviraveda. When all the treatment protocols fail, still the pain is not going under control. So Siraveda and Agnikarma proved to be very beneficial. So I will share the experience of some of the patients. So I have lost some of the patients because we have started with Snehanadi Upakramas and other things. The pain was very severe. Even with all the treatments, the pain is not going to be controlled. The patient sometimes start to or you will lose the patients. So whenever there is an severe acute pain, so we have to manage the pain first. If you go for Abhyangadi Upakramas, definitely there will be aggravation of the pain and we may lose the patient. So in such conditions, I have tried with the Agnikarma and Siravada in the very beginning itself. We don't do any other external Upakramas. We just go for Agnikarma and Siravada. So there will be a significant reduction in the pain, acute pain. Then after some time, when the pain reduces, so we will start with other Panchakarma and Bahi Parimarjana Upakramas. So these are some of the videos I have taken. These are the Agnikarma procedures we regularly do in our hospital. Even we practice regularly the Siraveda or Raktamokshana in Gridrasi conditions. Then Khalli, as I am mentioning, it is an acute injury condition. So Ushna Upanaha or the Svedana is mentioned, Upanaha Svedana is mentioned. So we have to follow that to control the condition. So there are the Asthikshaya symptoms we find. So whenever there is Asthikshaya, osteoporosis, degeneration is there. So Tikta Kshirapana internally, Tikta Gritapana internally, or Tikta Kshirabastis, Matra Basti, and even Gandhathaila proved to be beneficial in osteoporosis. So we have to strengthen the weakened bones, and so that has to be taken care of in the disease. And Vihara plays an important role as the cause of the Prushtvamsha diseases or the spinal diseases are the Vihara. So like that, the further damage can be minimized, so that proper vihara has to be advised to the patients. Samasana, that is proper posture while sitting, walking, or standing, or sleeping. We have to maintain the proper posture. So avoiding the same posture for longer period has to be avoiding has to be advised, and we have to practice good practices for computer use or table whenever sitting on the chair. Good practices has to be maintained. So sometimes whenever the patient is very obese, unless we advise or the patient loses the weight, sometimes the reduction in the pain is not being observed. So weight loss is an important aspect whenever the patient is obese. So we even suggest the udvartana to the area affected, so that can also be helpful. So weight reduction is an important aspect of our part of our treatment that we have to remember. So proper vyayamas, so overstretching or the twisting, so should be avoided, and the only the light vyayamas or which is proper exercises has to be advised. So avoid the twisting, stretching, tension over the spinal region. Not at the least, so we have to advise rasayana. So that we practice is Gugula rasayana and Lashana rasayana. So Lashana Kshirapaka, I advise almost every patient that I get. So Lashana Rasayana is having Koshtagata Vata. Koshtagata Vata, especially even in Mahavata Vyadi, whenever there is a Shula Pradhana is there in the Koshta. So Lashana proves beneficial. So that Lashana Kshirapaka I advise, especially for 3 to 5 days earlier in the treatment. So Lashana Rasayana, in the form of Rasayana also, in the form of Kshirapaka also, we can advise to the patients for a long-term benefit. So Patte is also an part of our treatment. We make equal importance to Patte as we give to the, for every patient we treat, whether it may be a Jora, whether it may be a cervical spondylosis. So Patte is the important aspect of our treatment. So as Vatalahara Sevanam, isn't it, is mentioned as the one of the important causative factor for the Vata Vyadi. So we have to advise Patya. So some of them are Kulatta, Masha, Udga, Mulaka, Shigru, Shiragrita. Dadi and Guda is mentioned by the Shushada. So which takes care of the joint when it is clearly Kevala Vataja and Dhatukshesh. So Dadi Guda as a like Snehapana, you can suggest Godu Mashali, Tikta Shakas, as Tikta is the best for Astiposha. So, and then Ajamoda, Shunti, Jiraka, Hingu, for seasoning of the food we suggest, and Darshana Sirapaka, as I mentioned, we advise to the patients. Coming to the conclusion part of our discussion. So there is a wide scope for Ayurveda physicians to flourish in this area, because there are wide range of treatment options are available. They are our strengths, because in conventional medicine surgery is the option, and it is failing to give the success rates, because we get the patients even after surgery, because only looking at the structural deformity we cannot decide the treatment, isn't it? So the whole understanding of the patient pathology or symptom is essential. Only by looking at the osteophytes, if you go for laminectomy, so many of the patients, even after surgery, we are unable to control the pain. The patients will come to us after surgery for the treatment. So surgery is not an best option here. So we have to understand patient based, understand the patient based on the stage or the condition he is coming, and accordingly treat the patient with a particular modality. So now lastly, advise the proper vihara and ahara. I have used the word vihara first and ahara later, because vihara plays an important role in the diseases of spine. So with this, come to the end of my discussion parts. I thank the organizers, Easy Ayurveda, for giving me this wonderful opportunity of sharing my views on the spinal diseases in Ayurveda. Thank you, one and all. Over to you, sir.
Thank you so much, Sidram Gulat sir. Spine is a telltale of how the human beings as we have evolved, and many people will be having some one or the other problems related to the spine at one or the other ages, the middle age and also the early old age and old age, or more susceptible. Youngsters are also not exempted from this, seeing the lifestyle today and also the food habits we have been undergoing. One question, Sidram Gule sir, considering Trika Shula, so this term needs to be properly understood by the Ayurveda practitioners and also the students of Ayurveda. So if the term is explored in a deeper way, so we get so many diseases coming under that particular term, an umbrella term, as you mentioned a couple of times here and there. So Trika Shula is also an umbrella term under which so many conditions that you have described comes right from the cervical, thoracic, everything, lumbar, almost all coccygeal regions, everything is covered here. So my question on behalf of all our participants is, should we assume any diseased condition occurring in the spine, should we assume it to be a vata roga or a vata vyadhi and have an approach, or how wise is it or how good it is to consider the involvement of Ama once the patients come to our clinic? So should Ama be addressed, Deepana, Pachana, those measures should be undertaken as default right at the beginning, like administering some kashayas or something which can deal with the Agni process and also the Ama process, or we have to thoroughly evaluate it, so then just remove it from the equation and deal almost all the disorders coming in the spine in terms of Vata Vyadhi. Because this question is because you also mentioned Ama Vata as a very important ingredient and Sandhigata Vata as an important ingredient. So in the story of the spinal disorders.
Very important question. So as I have mentioned, so spine is also a sandhi. Vata is an important part of the sandhi. So Vata Vyadhi, so the spine disease must be always first approached with the Vata. And I have highlighted in the Ama Vata the affinity of Ama and Kapha towards these particular sthanas. So we have to consider whenever a patient comes to us, we have to consider, evaluate for the presence of Ama and Kapha symptoms as well as lakshanas. Sometimes we may not get the lakshanas, but still we may be having the Ama and Kapha doshas. So it is wise to give an upashaya. So we have to start for 2 to 3 days of Rukshana and Pachana Upakrama, observe the patient. So then we have to, if it is a Kevala Vata, severely the pain will aggravate immediately if you do the Rukshana in Kevala Vata condition. So then immediately we have to assess that it is a purely a Vata condition, we have to start. So when we have given, we have came across the patients, we have given the Irandamuladi Nirohabasti in a patient of Kevala Vata, and the patient has increased the pain after 2 to 3 bastis of Irandamula. So then we have thought that it is more of Kevala Vata. We have immediately stopped the Irandamula Dikshara Basti and we have started with Kevala Anvasana Basti or Matra Basti, and the pain was subsided. So this is how we have to, in the journey of our treatment, we have to look into the development of the symptoms, and initially it is wise to start with the Rukshana and as because the Chakravarta has clearly mentioned the importance of Shodhana and Ama Pachana in the Kati Shula or the Gridrasi.
Thank you there, sir. And very important observation, what we need to do is, Dr. Sidram Gule sir was presenting in today's topic. Most conditions of the spine are also mentioned among Vata Nanatmaja vikaras itself, like 80 types of Nanatmaja vikaras. There itself we get a mention of so many. Trika graha is also a condition which is mentioned there. Trika graha and Trika Shula. So is it only on the basis of Kapha and Vata differentiation, sir?
In the Gatanigraha, he has mentioned the Katigraha or Katishula. Katigraha, usually we refer to the stiffness associated with the pain. Pain will be there with the Graha. So whenever Ama and Kapha is there, so there will be Graha. So whenever it is a Shula Pradhana, there will be Kevala Vata. So we can call it as a Trika Shula. But Trika Shula can include both Graha as well as Shula, what I feel.
Yeah, I think I messed up with the word Katigraha with Trika Shula while questioning. So like Graha and Shula. So that was the main point there. Thank you there, sir. And few basic questions here, because Dr. Sidram Gule sir some of our participants are Ayurveda enthusiasts. So and also they are from different countries. Understanding certain terms are difficult for them. Let's give a small clarification. So let's take the questions quickly and answer the questions quickly and shortly, sir, because we are running out of time. What is Kandara? What is Kandara? Jai Raghuji asks. Does Kandara mean nerve? I am clubbing the question. Vikramji asks, is it a ligament, tendon? What exactly is Kandara? So because certain terms in Ayurveda are used interchangeably with like Sira, Damani, Srutas, they are used interchangeably, and Kandara and also Snayu, these terms are also used, Sira, are interchangeably. So here, Kandara in this particular context, what do we consider, sir? Nerve, tendon, ligament?
So we have to take it a contextual meaning. Snayu is an ligament, what we see, and then the Kandara is Thula Snayu, the ligaments. So ligaments we consider largely as the Kandaras. But in context of Gridrasi and Viswachi, they have used the word Ya Kandara, Tam Gridrasim, Ya Kandara, Tam Viswachim. That says that whether he is referring to an nerve. I am still exploring this. It is my jidnyasa, because he is more concentrated upon, because the pain is also because of the tendon and muscles involved in the isolia. That also seems to be right. And even as he is telling, from the toe to the back, and well as from the finger to the back of the neck, that the long journey he is mentioning. So that is the longest nerve, as well as upper limb nerves. So that is spreading from that way to up to the fingers and toes. That seems to be, we have to consider both here, because we are not yet confirmed about it. But I feel that it should be considered as the nerve.
Thank you, sir. I think that clarifies a lot of things. When we read through the Sira and the Damani chapters, we get a lot of confusions. So I too, as Sidram sir said, trying to explore certain things, what exactly they mean, color-based classification, structure-based classification, so many things are explained. When we go through this Sira and Damani chapters of Sushruta, so a lot of confusions, we get a lot of confusions. Different modern day acharyas also have correlated them to different anatomical structures, but there is difference of opinion once again. So that will be a topic for some other session. So I think that clears it. Garunaji asks, where will disease progression lead to Gridrasi versus Viswachi, or both? Like disease progression lead to Gridrasi or Viswachi? Maybe a vata condition that might be.
They may be asking, the scholar may be asking, the Kati Shula, so is a primary symptom we observe. It will start with a mild pain in the Kati. When the compression or the hinge over the nerve starts, the pain presents as the radiation of the pain. So it progresses to Gridrasi, what I was meaning to say there. It is also possible that alone, it may be without the prior condition of Kati Shula and Gridrasi can occur. But usually the Kati Shula which progresses to Gridrasi, what I was meaning to say, the same thing will apply in the Viswachi also.
Thanks for the clarification, sir. And so here there is a common question shared by Vaidyagrima Avastiji, if I'm spelling the name correctly, Swapnaji. In Madhutaidika Basti, what kalkas can be taken? Kalka Dravya?
So there we use, the kalkas are mentioned there itself, that can be used. Or else we can use St Madhu, and then Ashwagandha, like then we use Amruta, and then Shatapushpa. The Shatapushpa will be always there in the that. But to fortify that, the Eshtimadhu. So usually in daha conditions we use Mahadhalika Pasti. So Eshtimadhu, Amruta, Ashwagandha will be the better choices for the Kalka.
Thank you, sir. Vikramji, yeah, is Lashana Kshirapaka prepared by boiling garlic cloves in milk? Is it just take garlic cloves, boil it with milk? Is it Kshirapaka or something else?
So usually we don't completely make it a kalka here, because it makes very tikshna. So we make advise the patients to just break the garlic clove into 2 to 3 pieces. So then 2 to 3 cloves like that, we will tell the patient to adding about 50 ml of kshira. And conventionally may not be a classical way. We add the same amount of water to the kshira, then advise them to kshiravashesha paka. Then we filter it and then advise the patients to take this before the food. And we advise only for 3 days, because sometimes if there is any pitta and other conditions, so the severe burning sensation or gastritis may appear. So very cautiously we have to use in pitta aggravated conditions. Otherwise, in vata kapha conditions, it can be used for a longer duration. It has proved beneficial.
Thanks, there, sir. Shira Avashesha, Dr. Sidram Gulat sir used the word there. Shira Avashesha is like only milk should be left over and all the water should be disintegrated or evaporated.
Definitely.
And Swapnaji, I think, has mentioned good question, sir. I have a similar question about Vata. I checked for Sotoroda, Balabramsha, Gaurava, etc. Dr. Sidram sir mentioned few Ama symptoms here, and I know few people who just go with the Jihva Pariksha for Ama. Don't know which one is right. Please clarify. Sir, is it objective or like subjective? So that is Swapnaji's question. How to assess Ama?
Definitely, it is an subjective as well as objective part. So we have to understand at what level ama is there. Is it at the level of kosta, or it is at the level of dhatu? So whenever you have a dhatu level of ama presentation, you may not have any presentations with the tongue or your appetite. So when it is at the level of kosta, you'll be having even the tongue symptoms or the appetite and other udara gaurava and all those things will be there at the level of kosta and amasya. When it is at the level of dhatu or only at the level of dhatu, so you may not find those kinds of ama lakshanas. So then shota, shula, stabdata, gauravata. So these will be the assessment tools that we have to consider.
Limitations in treating the spinal disorders. When we are treating spinal disorders, I'll club my questions. Limitations in treating spinal disorders. What limitations we need to see as an Ayurveda physician, which to take and which not to. So at OPD or IP level, whatever it is. And one more thing, at the end of your presentation, you beautifully explained about Agni Karma and Siraveda to be done. And in many cases, you were honest enough to tell that you lost patients because so there may be a, suspicion in the minds of the people what exactly these people are doing. Agni Karma and this one, Siraveda or the Rakta Mokshana or some adventurous treatments from the perspective of the patient. So here, I just want to know the criteria where not to administer Agni Karma and Siraveda, and what are the limitations in treating the spinal disorders? Couple of questions.
So the limitations, as it comes to limitations, so whenever the severe structural deformities are there, and especially in such conditions where there is an intradural or extradural tumors are there, cysts are there, ischemic changes are there. So such conditions very difficult to manage. We have not have the experience over those conditions. So those should be better managed with the other conditions, other streams of medicine. So severely indicated patients like severe canal stenosis, if that is the case is there, we should not make the patient to stay for long duration, because it is an myelopathy where completely the cord will be pressed upon. So in such conditions, decompression is an necessary treatment in those conditions. So we have to better refer to the patients to the surgical response. So whenever milder form or moderate form of such diseases are there, we have to go for the conditions like tumors, cysts, or the hemorrhages, or the fractures. So such conditions are better to refer to the conventional medicine, as I feel.
Yes, sir. Yes.
And regarding the Agni Karma, so whenever, because Acharyas have mentioned, especially not in Gridrasi or Kati Shula, wherever Agni Karma and Siravedas are these procedures are mentioned in the Charaka, he mentions it should be a last resort of your arrow. It's the last arrow of your bow. So it should be used at the last. Whenever all your treatment protocols fail, we have to resort to the, not each and every patient. We should not do the Agni Karma and Siraveda for each and every patient. Whenever these protocols fail, we have to go for the Agni Karma. And it is wise to understand where exactly this Agni Karma is going to help. So as far as my experience is concerned, Whenever an acute pain is there, the patient is unable to bend the body, unable to sit on the bed, very shooting, very acute neuralgia type of pain is there. At that moment, the agnikarma can give a very immediate relief to the patient. So later we have to go for the other upakramas, nehana or rukshana upakramas have to be advised. Alone agnikarma may not be helpful to the total patient.
For people abroad, what would be herbs that help manage the condition till they can come for a full panchakarma to India? Jay Raghuji asks.
I don't know which herbs are licensed or advised in abroad. The laws and other things there. But for Kati Shula, as I was mentioning, the Lashuna will play a role in the management. So likewise, Shunti Jala was mentioning. Shunti Jala with Eranda Tela is the best choice that is mentioned. And then like that, the Shimulas are mentioned. So Gomutra Arka is also an important choice that can be used. So even I think Trayodashan Gugulu, Rasana Gugulu, these herbs doesn't contain any the rasadravyas, so they can be suggested well. One case I want to briefly discuss is there was about around 70 plus age lady was there. She was unable to sit, stand, or walk. So she came to take a panchakarma treatment in our hospital very long back, around 6 to 7 years back. So because of inability of her to stay in the hospital because of that severity, lack of facility, so we have avoided the patient. The patient has avoided the admission. So then we gave her the just Rasna Saptaka Kvata and other one or two drugs to that patient, which was severely injured or affected. So surprisingly, after 15 days, 1 month of treatment, the patient came back. The very astonishing results we have observed. It is not that only Panchakarma is helpful. So even the Shamanaushadhi, just say Asana Saptaka Kvata with Shunti Prakshepa, that can help in the help surprisingly in the cases of Kati Shula or the spinal diseases. So Rasana Saptaka is just like a nectar to the patients of spine diseases that can be practiced well.
That's a statement of experience. So we'll take it. I think Jay Raghuji's question has been answered. Quick answers here, sir. Prashant Bandiji asked, in acute condition of pain, Raktamokshana treatment is how much helpful and how much bloodletting done, sir? Quick answer, sir.
So severe cases, whenever other procedures will fail, we go for the whenever all the treatment protocols fail, not doesn't give, so we go for the Raktamokshana. So one prastha is mentioned for we have to remove, but usually we go for 100 to 150 ml of bloodletting. So that will or we have to do the bloodletting as it comes. Usually 18 number leader will be used. So as it flows, till then we will allow the blood to flow. So automatically the blood flow starts after some time. So that will be the best way of the amount of blood to be let down.
Thanks, sir. Swapna ji asks, ankylosing spondylitis is very hard to treat. Yes or no, sir? To Ayurveda.
Yes, it is very difficult to treat in a modern hospital is already known, and even for Ayurveda it is a challenging condition. But the line of management goes with the Amavata. We have to adopt all the treatment protocols of Amavata. Somewhat we want to give the benefits to the patient.
Prashant Bandiji's question, if it is Kevala Vataja condition, then Raktamokshana is good or not?
Yes, Kevala Vata conditions we can do because Raktagata Vata, Raktagata Vata conditions, Ayurveda was mentioned because in Pitta conditions, Raktagata Pitta conditions, Jaloka is the best choice. But in Raktagata Vata, so Chiravada is the best choice. So definitely in Kevala Vata, Chiravada can be taken.
Thanks, sir. So Jaloka method is application of leeches. Chiravada is venous section or cutting the veins to or syringing the veins to let out the blood. Sandiji asks, how many sittings of Agni Karma are required or done usually?
So usually there is no hard and fast rule. As the case responds, only 2 to 3 sittings of Agni Karma we do. Whenever it is necessary, we can do, or it's not a regular procedure we can do for regularly. We should not go for the Agni Karma for every week for a year or like that. So it is as much as possible, we have to keep the Agni Karma short.
With how many days gap it should be repeated if required? Again, Agni Karma.
So usually we give in every 3 days. Every 3 days or after a week, we suggest the Agni Karma. If all needed, we can go for after a day or 2 days of. There is
Thank you,
no
sir.
just like a rule for that.
So thanks to Sidram Gulat sir on behalf of all our participants and Easy Ayurveda.
Thank you, sir.
Namaste.